Please welcome to the stage, Dean Karen Yarhi-Milo.
Hi everyone, how are you doing? Good afternoon, and welcome to this important conversation sponsored by Moms First and McKinsey and hosted by the Women's Initiative at Columbia SIPA's Institute of Global Politics. I'm Karen Yarhi-Milo, I'm the Dean of SIPA and the Adlai E. Stevenson Professor of International Relations. We are here today to discuss an issue that is essential to women's and families' economic security, and this is paid family and medical leave. I am absolutely delighted to be hosting the release of a new and important report by Moms First and McKinsey about who is using paid family leave and why, how satisfied they are with it, how to reduce barriers to its many benefits. And it feels fitting that we are focusing on paid leave at the first public event of the Women's Initiative since Jan Klein and Rachel Vogelstein have joined SIPA. Where are they? Yeah, here you go. Giving the initiative's commitment to exchanging research and policy locally, nationally, and globally, and to producing research and actionable policy proposals. I also want to take this moment to recognize the late Ann Kaplan, Columbia trustee emerita, and lifelong advocate for women at this university and beyond, for her visionary seed investment in our women's initiative that allowed us to bring our faculty leadership on board. So this is, thank you, Anne, and we're really, glad that we can do this and honor your legacy. Today's speakers are pushing paid leave forward. They're innovators, policymakers, scholars, and advocates. And to give you a preview of what we'll learn today, well, experts will take us through key insights from research. They will discuss policy prescription and lessons learned from states that have paid leave programs in place, and spotlight innovative ways to implement paid leave so that it best serves the working families who rely on it. And we are tremendously fortunate to have New York Governor Kathy Hochul back at IGP today to take part in a fireside chat with IGP Carnegie Distinguished Fellow, founder and CEO of Moms First, and a founder of Girls Who Code, Reshma Saujani. Thank you so much. Governor Hochul has been a leader on improving the lives of women and families, from signing into law New York's paid paternal leave policy to making historic investment in childcare, to recently proposing the expansion of New York's child tax credit. And it is really my honor to welcome the governor back to SIPA. But really, none of this could have been possible without Reshma, who is really a trailblazer in every sense of the word. She is a leading activist who has spent more than a decade building movements to fight for women's and girls' economic empowerment, working to close the gender gap in the tech sector, and more recently, fighting for the structural changes moms need and deserve, including affordable childcare, paid leave, and equal pay. So thank you, Reshma, for all that you do. And so without further ado, I am delighted to turn the stage over to Reshma. Reshma, the floor is yours. Thank you.
Thank you so much, Dr. Miller, for that kind introduction, and thank you to the Columbia School of International and Public Affairs for hosting us today. A special thank you to my mentor, Secretary Hillary Clinton, who couldn't be here with us today, but she's the one who hustled me into becoming a distinguished fellow here at SIPA. You never can say no to her, and has always championed my work, so I have so much gratitude to her. We're so grateful to be here. So, hi, I'm Reshma Saujani, And more than a decade ago, I founded an organization called Girls Who Code. We taught nearly over 1 million young people to code and really created the next generation of young women with computing skills. But the most important thing that we did at Girls Who Code is that we changed the culture. And forgive the humble brag, but we made coding cool for girls. And then the pandemic hit. And overnight, millions and millions of women were pushed out of the workforce, and moms were forced to make this impossible choice between hanging on to their jobs and caring for their children. And what I saw firsthand were that so many of my students had to delay going to college because their parents were essential workers, our nurses, our teachers, our critical workers. And because they didn't have paid leave, my students had to stay home and take care of their siblings instead of going to school. And I really saw how this generational cycle of poverty happens, especially for girls of color, because we have a broken structure of care. And so in the early months of the pandemic, I saw so clearly that the system was broken. And I realized I could teach millions and millions of girls to code, but if I didn't help their mothers, I had not solved anything. So I created Moms First, an organization that's dedicated to fighting for moms. And 3 years later, we are leading the fight for policies that are going to make a real difference and finally close the gender gap once and for all. Policies like affordable childcare, and of course, policies like the reason we're here today, paid leave. Look, I don't need to tell this group that the United States is the wealthiest nation in the world without paid leave. And literally, I have never met a parent without a story about how paid leave made a difference for their family or how they desperately wished that they had it. I literally got an email last week from a woman I know who said, listen, I just need to thank you. After the birth of my child, I had a life-threatening hemorrhage, and my baby was in the NICU due to a heart defect. And thankfully, we're both recovered now, but it was such a hard, stressful time of trying to take care of my baby and manage my business. And the only reason I was able to do it was because of paidleave.ai, because it helped walk me through a process and during a time that was enormously stressful for me. I have heard thousands of these stories over the past year. And these stories are only possible because 13 states and DC offers paid leave. But because of the fragmented landscape of these programs, we parents often don't have the answer to a real basic question. Am I eligible? And we, as policymakers, aren't able to evaluate whether parents are using parental leave programs. So Moms First and McKinsey said, we're going to fix that. We're going to help them answer that question. And we discovered something that I like to call the paid leave paradox. Parents love state parental leave, and you can clearly hear that in the story that I told you, but only 2 out of 5 eligible parents take it. Why? Well, we learned that it boils down to 3 things: awareness, complexity, and of course, men. First, awareness. 2 in 3 eligible parents didn't use paid leave because they didn't know it was available to them. Even in states where these programs have been around for literally decades, many parents didn't know that they could get paid leave from their state. Second, complexity. Despite the best of intentions, these programs are hard to navigate. It's hard to figure out whether you're eligible for paid leave when you have 0 sleep and a crying baby. Government hotlines are great, and they exist to help parents answer questions, but they can only do so much. And I don't know about you, but I don't have 5 hours to wait on the phone to see if someone's going to answer my question, so I give up. And so do most parents. Third, men. Men are 25% more likely to be eligible for state parental leave, but 25% less likely to take it. Why? Well, they think they don't have to take it if their partner is. What this all adds up to, complexity, men, awareness, is that the vast majority of parents, eligible parents, leave money on the table. And they do it at a time where the cost of living is so high and most parents can't afford to even pay for rent. And what's worse is we end up with this false perception that, well, parents don't really want paid leave. And it makes it so easy for politicians to say, why bother? Why bother to pass even a federal policy? Because see, they don't use it anyway. We launched paidleave.ai as a pilot in New York over a year ago, and last fall we announced the expansion of the tool nationwide, reaching every single state that has a paid leave program. And we have literally been blown away by the response. Since launching the site and reaching out directly to parents, we've seen Google searches for paid leave increase by 20%. We've seen tens of thousands of parents come to our site. And most importantly, we've helped countless people change their story for the better. Every single person that we reach has an opportunity of what we call a light bulb moment. It helps parents realize that they don't have to make an impossible choice between feeding their baby and paying for their rent. That support is available, and we're just getting started. That is why I'm so excited for our event here today, because we have this incredible group of leaders that are committed to accessing and increasing access to paid leave. We have leaders who are going to talk about their bold policies and innovative new technologies. And this work starts with getting to the bottom of what we like to call the paid leave paradox, digging deeper and understanding why parents aren't taking full advantage of the paid leave that's available to them. We know this as policymakers, you cannot change what you cannot measure. And so understanding this paradox is critical to making paid leave programs work for everybody and expanding them. So our next speaker is going to help us do just that. I'd like to welcome up Ramya? I want to say Ramya Parthasarathi. Yes. I mean, this is embarrassing. My name is Reshma Sajani, and I'm like, okay. Who's a partner at McKinsey. She's exceptionally brilliant and smart, and has just been such an incredible, incredible partner from the beginning. And we're so excited to reveal for the first time ever, publicly, our report. So come on up.
Good afternoon, everyone. It's a pleasure to be here. As Reshma mentioned, I'm Ramya Parthasarathi, a partner at McKinsey & Company, and have had the pleasure of partnering with Moms First on this very exciting research on the paid leave paradox. As Reshma mentioned, when she came to us to say, hey, we want to do more to accelerate our understanding and drive uptake of paid leave, our first question was, so who's using it? And the answer to that question, frankly, wasn't obvious. And so as someone who spends all of my time at McKinsey working with state health and human services departments across the country to drive access and utilization of essential government services, we said, let's partner together and build the fact base. Let's say who's eligible, let's figure out, are they utilizing it? And depending on what we find, let's dig into the real stories of the consumer experience and the parental experience to understand where is there a breakdown in that journey. So if you start us off on the first slide, as we began to dig in that question, it was obvious to all of us and well known, I think, across many folks in this room and perhaps nationally, that while the United States has no paid family leave policy, we were going to begin with the fact base of the 13 states and DC that do. Next slide. You'll see here that there is actually quite a big breadth of geographic coverage across the state, and a handful of states where the policy is in place, but not yet active. And so we said, let's just start with a few of the states that have the longest standing paid leave policies. Let's dig into their data and understand what the landscape looks like. Now, before we begin, I just want to level set on a couple of terms. For those who are more academically inclined here, you may already know the policy landscape well. But for those who are newer to this space, typically paid leave comes in the cluster of paid family and medical leave policies, which means that it is a wage replacement policy available to workers in case they have a major family situation. For most, that is parental bonding. For many, that is care for a sick relative or a family member or some other significant family situation. So it's a bundle policy that many folks can get access to. And the wage replacement for that typically ranges between 60 and 85%, depending on the state policy in question and the wage band of the individual that's eligible. States also typically impose additional eligibility requirements, and we'll talk about that in just a second. But I say this because paid family leave is not only a bundle policy itself, but is often one of another broader bundle of policies that are available to working parents as they think about the supports available to them. So other policies include things like job protections, some of which are a part of paid family leave policies in some states. Others have separate policies to provide job protections. Temporary disability insurance, which covers major medical needs for folks, and for many women that includes the run-up to the weeks of delivery and weeks following. And so there's an ecosystem, if you will, of policies that parents need to understand and access effectively, and that frankly, those of us who want to understand the fact base or think about the next horizon of policies, it becomes more and more complicated to unpack. So as we thought about this, we wanted to get into a few states to say, okay, what can we learn about the policies here? And before we began, we actually grounded ourselves in why do we care? This room, I think, already knows why they care, but I wanted to just take a minute to orient us in what the literature has said about why these policies matter. So if you flip to the next page, this is a big deal, and it's a big deal not just, as Reshma said, about the improved well-being of children, families, and parents, where we know there's real concrete literature that says there's improved maternal well-being in terms of psychological stress, decreased rates of postpartum depression. We know this has a huge impact on neonatal mortality, including improved child health outcomes. And as jokes about men aside, this does lead to more equitable households. So when fathers take paid parental leave, they're more likely to equally divide household tasks over the lifetime of that child. So there are real sticky effects from getting in on the ground floor and making sure you're reestablishing the gender norms in the household. But beyond that, and part of the reason we were excited to look at this across a number of different states was that there are a number of economic competitiveness reasons that make paid family leave policies really important. First, there's lower turnover costs for employers. So we know that for folks who leave the workforce temporarily and come back in, it actually enables the employer to not have the same level of turnover cost. Small businesses cite paid family leave as actually a competitive advantage they can have in the marketplace to help them stay competitive and attract talent. We'll talk a little bit about what role employers play in just a minute. And then the last that I think all of us here in this room care about is increased labor force participation rates for women. So we know that the maternal labor market detachment decreased 20% after the implementation of paid family leave policies in California. And when you look globally, actually, countries that have the strongest paid family leave coverage tend to have much, much more equitable labor force participation rates. So it's a structural change that actually can drive the structure of your labor market differently. As we thought through sort of why paid family leave for bonding, which is the term, by the way, that I'll use for just the subset of paid family leave that focuses on parents, we wanted to say, okay, let's dig in then. 3 questions here if you go to the next page. 1, who's using paid family leave for bonding today? 2, what are the barriers for access? And 3, what can be done to increase uptake? Moving to the next slide. To understand who is using paid family leave for bonding today, we realized we were at a little bit of a data impasse, right? And so the first question was, where do we go to understand this? What are the sources of data that we can use? And so we pulled far and wide from the 3 states with those longest standing policies, that is New York, New Jersey, and California. We pulled information from the American Community Survey, from the Bureau of Labor Force Statistics, and we pulled from state-specific claims data. Now, the caveat I want to provide here is that we were looking very closely at paid family leave policies that are at the state level. So this is mandated public policies. Employers have the right, the privilege, and sometimes the competitive advantage to offer paid family leave policies above and beyond that as a supplement to that. And in states where it doesn't exist as a way of actually drawing in some of their labor force, unfortunately that data is largely private. And so while we have high estimates from the BLS that about 1 in 3 workers has access, the vast majority of workers do not. And the access to employer-based paid family leave really varies widely depending on the employer in question, with smaller and lower income wage workers much less likely to access it. So we know this is just a part of the universe, but I think it's an important part of the universe to begin with as a safety net program. A couple of assumptions I'll make for those who are much more academically inclined in this room and want to understand how did we figure out who is eligible. So the first thing we had to do is figure out who's a recent parent. And so we used the census data to identify parents as those who have given birth in the last 12 months and their cohabitating partner, so we could get both parents in the household. Unfortunately, we were not able to link census data amongst non-cohabitating parents, so we were going to underestimate some of the eligibility coverage there for non-cohabitators. We pulled a bunch of the wage worked data, the time worked data, and continuous employment data, which are parts of the eligibility funnel I'll go through in a few minutes from the American Community Survey. And as I mentioned before, all of our utilization data comes from state claims data directly. All right, so first question, who's eligible? If you go to the next slide, all of the paid family leave policies that we've seen typically draw down eligibility through a couple of lenses of this funnel. So the first question is, for parental leave, have you had a child in the last year? If so, are you active in the labor force, by which that means you are either currently employed or seeking employment? For some states, you actually have to be currently employed. And then states typically impose a state-specific wage threshold or time worked requirement as a sort of basis to say, we're only going to replace a wage if you have a sufficient wage for us to replace, is I think the logic behind a lot of these policies. And if you pass all of those thresholds, then you're eligible. So the first question we had was, oh my God, is this going to screen out too many parents, right? Is part of the question really around the stringency of the policy structure? And if you flip to the next page, this is an average across the 3 states that we looked at. But what you'll essentially see here, macro takeaway, is that 3 out of 4 parents are eligible for paid family leave. And if you look at just those who are active in the labor force, it's 8 out of 10, right? The vast majority of that drop-off in eligibility is driven by whether you're inactive in the labor force or not. So this is the structural question, right? What drives whether you're someone who's seeking employment or actively employed? And as those of you who study gender equity know, inactivity in the labor force is much higher for women than for men. So this is a little bit of I don't want to call it a chicken and egg problem, but there is a question of how do you make policy such that women don't just exit the labor force, full stop. The other 2 drivers, whether you're actively employed or you meet state-specific wage requirements, is where you see some variation in terms of the specifics of state policy. So just to give you some flavors of it, California, for example, does not require you to be currently employed. In New York, for example, the wage requirements and time work requirements includes a requirement for continuous employment with the same employer. And part of that is driven by the structure of the benefit itself. I'm going to just give you a little more technical terminology for a minute. The 2 types of benefit structures we see in terms of these policies are, one, either social benefits or private benefits, where social benefits are those that you access directly through the state, and private benefits are those that you access through your employer. I want to show you just a couple more quick findings, then I know we have lots of exciting additional folks to come up and talk about this. But if we go one step forward, there was the question of who's eligible, but then really the question of who's using. And this, as Reshma highlighted to us, 3 in 5 eligible parents do not use state paid family leave for bonding. And they're leaving about $6,000 to $10,000 on the table. The context for that number, at least for me, was striking. It's like, what does $6,000 to $10,000 mean for the average household? Median childcare for a year in America is $6,000 to $12,000. So this is a year's worth of financial benefit that they're leaving on the table. For some parents, leaving that on the table means going back to work, which we know means a trade-off in terms of valuable time spent with their child. For others, they're leaving it on the table and exiting the workforce. And so for them, that's just really dollars out the door. If you flip one page forward, some of the drivers of this as we looked, the first piece you heard already Reshma say, there is a huge gender gap. If we look at who's eligible, men are significantly more likely to be eligible and less likely to utilize. A lot of that eligibility difference is driven by both labor force participation and wage rates. Very unsurprising on the right-hand side here that if you look across different wage bins, so in lightest green you have folks who are earning annually under $40,000 in wages, $40,000 to $100,000 in dark green, and over $100,000 in bright white. Eligibility is much more for those who are higher earners, and uptake is higher for those who are higher earners. And part of what we'll talk about in a few seconds as we get to drivers is the issue around, is the wage replacement sufficient? Am I worried about job loss and what that's gonna do? If you flip one page forward, I just want to show you briefly some of the race ethnicity findings as well. Where data was available, which was not in every state, you find also some unsurprising trends given what we just heard on wages, which is that whites and Asian or Pacific Islanders are much more likely to be eligible than Black and Hispanic and Latino folks. But from an uptake perspective, quite interestingly, you see uptake rates amongst Black parents as high as white parents, with lower rates of utilization amongst Latino and Asian and Pacific Islanders. Let's talk a little bit, if we could flip one more page forward, about understanding these utilization rates in context. So if 2 in 5 parents are taking it, we've ranged it here given some of the eligibility ranges in states with continuous employment. But what we find is that if you look at the big bucket social benefits that are available, paid family leave is about half as well utilized as unemployment benefits, which is, I think, the most appropriate analog because it's not necessarily a classically means-tested program like Medicaid or TANF or childcare. But when you think about utilization rates in this context, like how much folks are using it, the striking finding is how much folks value it. So if you flip 2 more slides forward, and I realize I'm a little bit short on time here, we asked folks through a survey of over 2,000 people across these 3 states, did you use paid family leave? Why did you not use paid family leave? And what was your experience and satisfaction along the journey? As Reshma mentioned, there's 3 things that we learned. Awareness is an issue. There are economic and career considerations that folks internalize as they think about the complexity of applying for these programs, and real deep-seated beliefs around whether or not you need to take it. And the biggest divide that we see on the right-hand side, if I could just highlight, is that we thought it would be a stigma gap for men, but really the bigger driver is men saying, my partner was taking leave, so I didn't think it was necessary. I realize I'm deeply over time, so I am going to just flip to 2 more findings that I think are particularly interesting. If you could flip 1 page forward, the first is just putting satisfaction with paid family leave from those who take it in context. It is as high as almost every other government or private benefit that's out there. It is on par with how folks feel about retirement support. It is more satisfying marginally than childcare support, and it's on par with the types of e-commerce, online, private sector benefits that you often see. That is very rare for a government benefit. We do a lot of work at McKinsey on understanding satisfaction with government services, and typically the government benefits are far underappreciated because they're so hard to access. So we actually tried to look at some of those access considerations, and if you flip one slide forward, we actually mapped out across the journey, if you will, from learning about benefits being available to determining if you're eligible, all the way through whether you receive the benefits, what the level of satisfaction folks experience is. And what you'll see, unsurprisingly, is you've got the biggest dips when it comes to learning about the journey and understanding if you're eligible. It's like reading Greek to most parents to knowing, did I meet the wage requirement? Did I meet the time worked requirement? They're happiest, of course, when they receive the dollars. I'll flip just 2 more slides forward, if you wouldn't mind, and just talk briefly, and this will hopefully be a good impetus for the discussion later this afternoon, what can be done to increase uptake. If you flip 1 page forward, the things that we heard were, 1, awareness matters. So almost every testimonial and survey we described had folks saying, I would have taken it if. And that if was largely if I had known. If I known I was qualified, if I had known it was available, or if my employer had been able to answer the questions that I had about it. 2, if you flip 1 slide forward, is that actually employers play an outsized role, even though it's often a state benefit. And this is because folks come to their employers as a source of knowledge, and you see that in New Jersey and California. The state as a source of knowledge is less so than their employers, even though it's a state benefit. It's because they're accessing it in partnership with their employer. But also because they kind of want the comfort and certainty of knowing that their employer is their partner in this journey. If you flip 1 more page, The last thing I'll say is that, as with so many state programs, it's complicated. Applications are messy. We're all in tax filing season. That's complicated enough. As Reshma said, the stress of this period of life means that we need to do everything as we can across the ecosystem, whether that's as government players, as private sector actors, as employers, as advocates. And I think we've learned that technology can play a huge gap between policy and practice in terms of all parts of the journey. In my work across states, one of the things I've realized is that states are looking to think about how do you bring a consumer experience lens to the benefits that you're developing. And so that's partly why we're really excited about paidleave.ai and the application of using new technology to be able to say, how do we simplify this for the end user and the end consumer? With that, I think I am excited to just hear the discussion today to say, what can we do differently to drive that uptake and utilization? So thank you very much.
Hello, everyone. My name is Yasmina Mail, and I'm a first-year MPA student at SEPA, concentrating in urban and social policy, specializing in gender and public policy. I'm delighted to introduce our first panel today, Setting the Stage, Paid Leave Research and Policy Change, which will focus on how states are leading the way in terms of policy design and implementation of paid family and medical leave policies. We're joined today by a panel of experts, including Sharita Gruber, the Vice President for Economic Justice at the National Partnership for Women and Families, Jesse Workman, Senior Staff Attorney at A Better Balance, and Jane Waldfogel, Compton Foundation Centennial Professor for the Prevention of Children's and Youth Problems at the Columbia School of Social Work and an IGP-affiliated faculty member. Jennifer Klein, Professor of Professional Practice at Columbia SEPA and the Director of IGP's Women's Initiative, will moderate this conversation. Welcome.
Thank you. And I want to start by thanking you, Ramya, for sharing the key findings, really, really interesting, from the new Moms First and McKinsey report. Jane, you are my go-to, and some would say guru, on family policies generally, and on paid family and medical leave in particular. So I wanted to start with you with just some reflections on the findings that we just heard.
Yeah, well, thank you for this report. It's just a wealth of information about what's actually happening on the ground with paid family and medical leave. So I guess I would call out three sets of findings. One about awareness. It is kind of disappointing that so many years after these policies have come into effect, we're still having trouble getting the word out about them. So it's a clear message that we need to do better about that. Second, the issue of job protection just really looms large. People feeling like, I'm afraid I'm going to lose my job. The job protection piece is so complicated. It differs by state. It differs whether you're thinking about FMLA leave or paid family leave. And even if there is job protection, there are also these employer policies that penalize workers if they take too much absence, too much time off. So no wonder people are confused about it, and we really need to dig in and understand that better. The third finding I'd really highlight is this lower eligibility rate and lower usage by workers who are Hispanic. We see this over and over again. We've seen this over time. And so there's something real there. And it may be a question of being lower educated workers, being in smaller employers, maybe less formal employers, but there may also be some discrimination that's going on and some actual non-compliance with the laws. And so I think we need to take that really seriously, because these are workers who really need the leave, need the benefit, and are showing up in every survey as being less likely to be eligible and using it.
Thank you. Sharita, I'm going to turn to you next. We know that states are leading the way, and while, as you've heard, the U.S. remains a global outlier because we lack national paid family and medical leave, 13 states in the District of Columbia have passed laws that can serve as models. So maybe you could just tell us a little bit more about these laws, and in particular, the structure and the provisions in the programs that have been particularly important for working families.
Sure. And yeah, states are leading the way because the federal government hasn't done it. We were within one vote of having a national paid family medical leave program, and states have not waited for the federal government. And the reason is the need is dire. Only 44% of workers, or 44% of workers aren't eligible for even unpaid leave under the Family Medical Leave Act. 73% don't have paid family leave, and over half don't have personal medical leave through short-term disability. The racial implications and the disparities are massive. When we're looking at Black women alone, 1.1 million need leave but don't take it, and at a loss of $3.9 billion a year from unpaid or poorly paid leaves, which is why the information today is so important and awareness. It's something that's hugely popular with voters also. And so we've seen states adopting this in the 14 states, including DC, as a DC resident, I like to say. We see a trend in how they're modeling it and what works. And so some of the elements are comprehensive. It has to cover at least everything FMLA does: caring for a new child or family member with serious health condition, your own serious health condition. Military deployment is something that we're seeing a lot more of. Innovations like prenatal leave in New York and DC. And also, parental leave is not enough alone. It needs to be family and medical leave, since nearly 80% of people who took leave under FMLA were for reasons other than welcoming a new child. So it is extremely important, but you're not going to get as much use if you don't have comprehensive benefits. Also needs to be inclusive. Folks had mentioned that when we're talking about low-wage workers, part-time workers, the greedy jobs that are disproportionately women of color working them, you have much lower rates of access to paid leave. And so it's so important to make sure part-time, low-wage workers are covered, workers at small businesses, making sure you have the right family definitions. It needs to be meaningful and adequate. Again, we found no less than the 12 weeks that we have in FMLA, ideally more. And also the wage replacement has to be at a rate where it's worth it for workers. It's not going to be worth it if they're not getting enough money to keep surviving and keep supporting their families. It also has to be secure. Again, folks can't be afraid of retaliation and discrimination for taking the leave that they have a right to. Programs have to be sustainable, fully funded, in a reliable, low-cost way that does not harm workers or employers and does not raid other safety nets or benefits to pay for the program. And when you do it the right way, it works. Like the partnership today just released research that in Massachusetts, which they have a program that meets all of these requirements, for folks with depression, they had one fewer poor health day per month, at an amount of up to $1.2 billion in productivity gains annually from reduced absenteeism. And for folks with heart disease, February Heart Health Awareness Month, up to $330 million in productivity gains just from the existence of a paid leave policy that works.
Thank you. Jesse, I'm going to turn to you because another important issue that we started to hear about and I want to dig into a little bit more is implementation. So it's great to have a law. It's really important to implement that law well. And so we wanted to ask you, what has a better balance found to be some of the biggest barriers to utilization of paid leave benefits? And also, what can we learn from states that are really successfully implementing programs?
Yeah, this is a really important question. And at A Better Balance, we work on advancing family justice policies across the country, and we have been involved in passage and implementation of all the states that have paid family and medical leave laws. And we also have a legal services program that includes a national helpline where we hear from workers across the country about the barriers that they're facing. And in New York, we lead the campaign to modernize our medical leave program, which New York has a little bit of a different situation with family and medical leave, and I'll talk about that a little bit in a bit. But on the ground, in the implementation process, we see a lot of the components that Sharita was speaking to and how they play out in implementation. So it's important provisions like, I mean, you named it, but job protection. If workers don't have job protection, especially low-wage workers, it's impossible to be able to take leave, and we see that in implementation also with continued health insurance, which a lot of times comes tandem with job protection. The wage replacement amount really can't be overstated for low-wage workers. If people are struggling living on 100% of their wage, then it's impossible to live on 60%, 70%, particularly when adding another member of one's family. And I saw today that Robinhood and Columbia released new research showing that 1 in 4 New Yorkers are living in poverty. And so I think we really need to look at the basics before we talk about the more nuanced pieces of implementation. And some of those pieces are important too, like what are the enforcement provisions like? What are the education efforts? Some states have done a really good job at training workers and employers to really make sure workers understand what their rights are. Also, are the application process, is it user-friendly? Is there language access? All these things are really important, but the core components need to be focused on. And New York does present a really good example of what happens when those core components are left behind. So I spoke to it earlier, but our paid family leave program replaces wage at 67% and includes job protection and continued health insurance. And New York was groundbreaking in 2016 when we passed paid family leave. However, our paid medical leave program is far behind and hasn't been updated since 1989. And workers who need medical leave, and this includes pregnant workers who may need leave to deal with a difficult pregnancy, are only entitled to $170 without job protection or continued health insurance. And it's just a really good example of what the barriers to utilization can look like.
Thanks, and that is a perfect segue to Jane, a question I was going to ask you about sort of how we design policies generally that support families. You know, and again, there are good state models, there are states that are trying to still figure this out, but how do we think about these policies together? And I mean, these policies can include things like beyond the paid family and medical leave issues, paid sick days, childcare, child tax credits. Sort of how do we think about these as the full range of policies that families need?
Yeah, it's a really good question. I'm glad you asked it because sometimes we focus on one policy or we think it's one or the other and it's and because families need the whole array of policies. I think honestly the other policy, I mean, states have always been involved in child care policy in a big way, and states continue to be a very important player in the child care arena. But in the other arenas that you mentioned, states have really learned from the passage of these paid family leave laws to think about, good, I can step in and do other things in this space. So a number of states now have these paid family and medical leave laws, and now you also see states having paid sick leave laws, which my former student Meredith Slopin has studied. And there's now, I think, more of these state paid sick leave laws than there are paid family leave laws. So that's, you know, a clear example of states saying, we shouldn't just stop with paid family and medical leave. Let's step into the paid sick leave space as well. More recently, it's been really exciting to see states stepping into the child tax credit space. So I have to say I'm sort of obsessed with child tax credits. I just finished a book on child benefits. It's coming out from Russell Sage in June, so I'm just going to mention that. Back in 2006, New York State was the first state that passed a state child tax credit that augmented the federal child tax credit. And for a long time, New York was the only state that had a state child tax credit. But there are now 15 states that have state child tax credits that supplement the federal credit. So, you know, especially in this particular moment, when there may not be a lot of positive stuff happening at the federal level, although there may be some expansions of the child tax credit, it's really important to acknowledge the work that the states are doing on the child tax credit and on the whole constellation of policies. And if you look just within New York State has expanded its child care supports, New York State has expanded its paid family leave law, it's expanded its child tax credit, even though it already had the first in the nation. It went back and said, oh my God, we're leaving out young children, let's include them. And Governor Hochul has now proposed a major expansion of that. So we've got folks like Governor Hochul who are really doing it across this whole array of policies. So I think it's really important to acknowledge that and applaud it, because now more than ever, these state efforts are going to be really important. And it's not just one policy, it's the whole array of policies that families need.
And Jessie, as we've heard now twice, you know, there's definitely a need, particularly in this moment, for states to not only step in, but build on what they've already done. So tell us a little bit more about what we can expect from states in this coming year, particularly on paid family and medical leave, but anything else you want to add?
Yeah, I mean, we're seeing incredible momentum on the state level across the country, and we're engaged in moving many policies forward in different states. I can just give a few examples. So in New Mexico, they have a several-year campaign for a paid family and medical leave program, and it looks like it's going to be successful this year, which is great. In Virginia, it's looking like, again, the bill is going to pass through the legislation and be vetoed by the governor, but it's really exciting that they're moving a bill forward. In Pennsylvania, there's a paid family and medical leave bill that was introduced with bipartisan sponsorship, which is really encouraging. And again, that may not happen this year, but it's exciting to see the momentum. And then in New York also, it's really exciting to see the passage of the prenatal leave, and we're hoping that we're able to get this medical leave bill forward so we're able to bring our medical leave program up to date with the rest of the states that have paid family and medical leave. And I'll also say we're working with a dozen other states that are in the very beginning process of having campaigns, and it's really exciting to see that there is bipartisan support for paid leave. Despite everything that's happening on a national level, people really do want and need these policies, and momentum is moving forward, and it's exciting to see.
And are states talking to each other, learning from each other? You feel like there's...
Yeah, I think states are learning from each other. And one example, I didn't speak to this earlier, but I meant to, even in the case of, like, let's say, inclusive family definitions, states are now starting to bring along model inclusive family definitions, which are very important because, as we know, the traditional nuclear family is no longer the norm, and families look in all different kinds of ways. And inclusive family definitions are something that as new states are passing laws, they're including them, and it's really important for LGBT families, for people with disabilities. We see that it increases access to leave for people who need it while not really making a significant dent in the usage rate, which was what some of the fears were. And we're seeing states are talking to each other, and that's one example of that.
Thanks. Sharita, back to the federal level, as you noted, particularly painful for me, we were just one vote short of passing a comprehensive paid family and medical leave at the federal level, but we have seen some movement through the bipartisan, bicameral paid family leave working group. So tell us more about those policies, both the pros and the cons of what is being discussed at the federal level.
Sure. Well, paid family medical leave is extremely popular with voters. It has polling to the point where now it's a value, not just a policy. And so even like electeds on both sides of the aisle can't ignore that, and they can't ignore the stories they're hearing from their constituents. And so a bipartisan working group was established in Congress to try to figure out a path forward. From the beginning, they were realistic, like, we are not in this group going to come to something that's going to be a national comprehensive program. But they were trying to see, like, well, what can we do and agree on? They came up with a few ideas to kick the tires on. One being a tax credit, one being a type of grant program for states that want to work on this at the state level with some support. And so, they're still figuring out what to do exactly and how to move this forward. My stance is more paid leave for more people is always good. But the research doesn't show that voluntary programs and tax credits are actually going to expand access to paid leave. So, for example, we've had a tax credit for companies since 2017 in the 2017 tax bill or tax law. And the truth of the matter is it's kind of become a subsidy for major corporations. 88% of the credits claimed went to corporations with $1 billion or more in revenue. This is not closing the gaps in access for low-wage workers or others who haven't traditionally had as much access to these programs. Also, You can see that if you look at expansion and access for the lowest paid workers since 2017 when this was enacted. Paid family leave access among the lowest paid 10% of workers went up from 4% to 6%. So it's barely noticeable change. The other group that is struggling to access programs like that are small business owners. We did polling with Small Business Majority, and when you're talking about entrepreneurs, this is a very conservative, very male, very white group of people, and support for a national mandate for paid family medical leave is through the roof among this cohort. 79% wanted a national program that would guarantee employees wage replacement for up to 12 weeks, funded by 0.5% employer-employee contributions, which is kind of what we're talking about when we're talking about national program. This has, once again, increased since we polled in 2017 when 70% supported it. So they saw the tax credit, they said, no, thank you, we still want national, and that increased. When you break it down by party, it's also fascinating. 72% of Republican small business owners want that national mandate program. They preferred a national program to a voluntary program by 2-to-1 margin, and 40% want to replace the 2017 tax cut with a national guaranteed program.
And just for those who aren't as deep in it, say why. What's your theory of why you think small business supports it?
Oh yeah, so the way that the credit is currently designed, it's just not worth it for the small business. They have to front end the money. They're not going to really get full repayment back. And so the logistics and the structure of it has been pretty prohibitive for small business to even access the program.
Thanks. Jane, last question is for you. We all know, and we've just been talking about how important research is for policy change and advocacy, and it seems fitting sitting here at Columbia University to close with a research question. So what are you looking forward to researching? What questions do you think are the most important questions that we need to be answering to achieve paid family and medical leave?
And I assume I can take more than the 2 minutes that's showing on the clock, because that's like about an hour. I could talk for the next hour.
You can do it in 3.
I'll do it in 2. No, I'll do it in 2. Yeah, so I think we need so much more research on the nuance of these policies, on, as Jesse was saying, the details really matter, the replacement rate, the job protection, who's covered, how many weeks, how easy it is to access, what the awareness is. All the research that we've done to date has tended to be comparing states that have a law or don't have a law, or states before they had the law and after they had the law, but not distinguishing the different types of features, the different parameters of the laws. We now have enough state laws and enough variation in these parameters that we really should be looking at. How much does job protection matter? How much does wage replacement matter? How much does the payment rate matter? How much does family definition matter? How much does this requirement that you have to have tenure with an employer matter? So that's going to be like the next generation of research. I'd also say that almost all the research that we've done on paid family and medical leave has been on paid parental leave. The single most common use of paid family and medical leave is leave for one's own illness. We have hardly any research about that. What do we know about parents who have a kid with a serious health condition? 15% of children have a serious chronic health condition. What do we know about leave taking among those families? Very little. What about parents or adults who take leave for their partner, for another family member, for an elderly relative? When these state legislators are passing these laws, a lot of them are thinking about elderly relatives. That's what they're thinking about. Somebody's mother or grandmother falls and breaks their hip. They need to recuperate. Somebody's going to be able to help out and take leave for that purpose. We have hardly any research on that type of leave. So boy, is there a lot for us to do. I think fortunately, it used to be that people would say we really need more work on employers to understand why employers are opposed. And I did a ton of work with my colleague Ann Bartel here at the business school, and we surveyed employers in a bunch of states, and our figures are very similar to the ones that you were just citing. 70% or more support these laws, and support went up during COVID. because people had experience with seeing people take leave, and the support went up, and support went up especially among firms who had employees who took leave. So I think that's why we're seeing higher support levels now. So I'm really delighted now that we probably don't need more research on employers, because now we sort of know that actually even small employers are supportive. So yeah, that's pretty good. We've got 2 seconds left.
Well, thank you all for this conversation, but also most importantly for the work that you are all doing every day to advance and understand better paid family and medical leave. So thank you.
Please direct your attention to the stage.
Good afternoon. My name's Chelsea Tabachnik, and I'm a senior at Columbia College and an IGP student scholar. I'm writing my senior thesis on why some states pass paid family and medical leave while others do not, looking at a range of indicators from state GDP to the percentage of women in the state legislature. It's my honor to introduce the next part of this program. Please join me in welcoming to the stage New York's 57th governor, Governor Kathy Hochul, and Moms First founder and CEO, founder of Girls Who Code, and IGP Carnegie Distinguished Fellow, Reshma Saujani, for their fireside chat.
Well, it's so great to have the governor here. I am a huge fan, and we have worked together on so many different things. You've been a massive champion for Girls Who Code. I love the story that you always tell about your sister and about technology and how critical the role of coding and technology played in your life. So it's an honor to be here with you.
Thank you for having the brilliance to conceive the whole idea of Girls Who Code, because we in New York are the beneficiaries of a whole generation of young girls who had the chance, because of your efforts, Reshma, to just learn skills in coding. And these are kids whose parents were not engineers. They did not have a role model at home, but they're introduced to it because of the programming that you did. And I saw so many young women, high school and middle school kids, that their eyes are just lighting up because they think, maybe I can do this. So this is a real credit to you.
Thank you. Well, I appreciate it. And in a moment now where it feels like we're dismantling a little bit of women's progress, to know that we have flooded the pipeline with so much talent that we're not going to go back.
That's right.
I think it's
That's right.
And it's a testament to your commitment to it. So listen, we're here to talk about all things moms, paid leave, and childcare. And what I love is your real personal connection to this. You're not going to believe this, but Governor Hochul is New York's first mom governor. Like, how amazing is that? Right? A mother, grandmother, like, you've seen firsthand the cost of diapers and the juggle that you do before you even had your first cup of coffee between managing childcare and getting to the office on time and just negotiating just all of it. And, you know, I think this is why it's such a passion for you. And it's because you recognize what New York families are going through in this moment. So talk to me a little bit about how your personal story, your personal experience as a mother has really played a role in how you're prioritizing these issues as the governor.
A major influence in my life is what I dealt with a long time ago when I first had my children, and there was no childcare. I had to give up a job I absolutely loved on Capitol Hill. I was counsel to Senator Daniel Patrick Moynihan, but there was no one to watch my little baby, my son. And we went from both my husband and I working in big law firms to becoming a public servant. He went to work for the Department of Justice, so all of a sudden our incomes went down by half. And then I couldn't get childcare, so then we went down to me not working. So all of a sudden, we had one good year. We thought we were doing well. And all of a sudden I said, oh my gosh, I can't imagine we're gonna feel so rich when we stop paying for diapers and formula. Can you imagine what it's like when we don't have to spend most of our money on kids' clothes that they outgrow every 3 months. They literally are 3 to 6, 6 to 9, because they're always growing. So I had to pay the bills. I had to figure it out. I had to figure out how I could set up a little home office and find someone to come in and watch the baby in the afternoon, and I was trying to pretend I had a home office, and that must be that noisy childcare down the hall, because I'm definitely not sitting in my basement with a baby next to me. So it was a different time, but the stress is still there, and this is real, and I know it's real again because that baby I had all those years ago is now a dad himself. He's got a 2-year-old, so I'm watching them struggle, and right now he's a Department of Justice attorney himself in Washington, wondering when the axe is going to fall. They may be living in my basement again, I don't know. But this is the stress they're under. So it's personal to me because I lived it. And when I see moms today, it's like they didn't ask for inflation, they didn't ask for a pandemic. There's so much more stress on families today than even what I was dealing with. I want to get that right out there. I see that, I feel it. And the cost of everything. Everybody promised that prices are going to come down after the election. Remember that one?
Yep.
I noticed that the price of eggs went up 18% since a certain person got
inaugurated. If you can find them.
Yeah, but 18% increase since Inauguration Day. Okay, I'm watching these things. The prices are not going down, they're going up. So yes, this is a passion of mine, and anything I can do to help families just breathe a little easier and enjoy this time in their lives, because it's going to go so quickly.
Yeah.
The stresses are great, but you're going to look back like I do. It's like I miss when they're little.
Yeah.
And,
I'm so glad you raised this because, as you know, 55% of parents are in debt because of the cost of childcare. It's like the number one expense for families. We did a bunch of focus groups recently, and these stories of moms across the country, across party lines, basically having to trade off their jobs. Women who went to nursing school, loved being a nurse, had a baby. They do the math, and guess what? The math doesn't add up. And so what happens is they have to downshift, right? Or give up their careers just to put food on the table. And so, and this is happening at a time in federal government where we're actually seeing them cut the child tax credit, cut the child care tax deduction, right? Make it actually do nothing about the promises and the commitments that they made to actually reduce the cost of child care, but actually make it more expensive. Being a mother is out of reach, which is why we have such massive depopulation concerns. People don't want to have a baby anymore. They can't afford it.
They don't know how they can do it.
How can you do it? So what is the role of state governments?
It's significant. If you have a state that feels responsible for the well-being of its constituents, its people, then you take a major role. When I first became governor 3 years ago, I announced an initiative to bring $7 billion to childcare. No one had ever come anywhere close to that. And what does this look like? It was trying to get places that have been closed down during the pandemic reopened, try to hire more people, try to give people opportunities to get the training. So there's 1,000 different ways we figured it out. And I have really smart people like Emily Cater here who's been working with me to try to solve this. But we have to focus on it. And I've also gone around the state literally for a decade telling employers, you have a role to play. I remember I was invited up to a major semiconductor manufacturer in upstate New York. And it was Women's History Month. I'm really popular during Women's History Month, right? It's got to have the woman, lieutenant governor. So he said, we have 3,000 employees. And I said, you have very few women in this room. And he says, I know, I don't know what to do. I said, I have the answer for you. Build an on-site childcare facility and people will be banging down the door to work here. Not just moms, but dads who want to check in on the little one during their breaks. I said, it'd be a game changer. And we were able to do something that is extraordinary. Micron, which we were able to land, working hard with the Biden administration and Senator Schumer, I was able to get them to come to New York. 50,000 new jobs. And guess what? They're building a child care center on site so they can attract more women and moms and dads and these stuff. So when I have leverage at the state level, you want tax dollars to assist you. I want you to come. This is great. I want you to expand. This is great. But I need you to help further my public policy objectives as well. You're going to build sustainable buildings. We're going to have, everything's going to be LEED certified. We're going to make sure we're protecting the environment. And you're going to take care of the workforce, which means building childcare, finding a way to get around childcare challenges. So we have to start putting it, we never talk about this, putting it back on employers.
That's right.
You want to be competitive. You want to have the best talent. And you also just give more flexibility, like we have in New York. And what we've mandated is the paid leave time, because it is a short-term investment in an individual. You give them what they need to be able to take the time and be able to come back. They could be with you for a long time instead of rapid turnover. And it's a cost saver for employers as well. So they need to think about it. It's in their strategic interest to take care of this huge challenge. And the cost, it's higher than a public college education now. I mean, you have 2 children. This is the rest of the state. New York City is even off the charts. But $21,000 to take care of an infant, 2 kids. Like, you're making a minimum wage job.
Yep.
It does not add up.
Doesn't add up.
You cannot make the math work out. And that's a real, it's sad to me as a mom, but also as governor, I'm more motivated to try and solve this.
Yeah, and the unconscionable choices. I mean, 50% of New Yorkers live in childcare deserts.
That's right. That's right.
One of the most interesting. We have some of our funders here from Robin Hood and some incredible professors here at Columbia have done incredible research of just showing also and some of this is really we need more innovation because oftentimes it's lower income women that are concentrated in neighborhoods which happen to be in childcare deserts, and there's an open storefront right next door, right? And so there's real solutions. But I think the business piece of Jen Klein's here. She obviously did so much work on this with CHIPS, really, and so much innovation that came out of the Biden administration through her leadership and really organizing kind of businesses, making sure we're uplifting the voice of childcare workers so we do not leave them behind, really, in solving our childcare crisis.
But you look at sometimes it's even a matter of zoning. Especially right after the pandemic, we saw a high number of vacancies in Midtown, for example.
Yeah.
And I'm always thinking let's put housing in there. What else can we do with this vacant space? It turned out it's coming back as commercial, which is good, but a couple of years ago we didn't know that. I said, why aren't we building childcare facilities here? Well, it turns out they only allow, because of zoning, to be on the first floor.
That's right.
And I said, why is that? Well, because if there's a fire, et cetera. Okay, I'm thinking a lot of these kids live in high rises, right?
Right.
Sometimes you just want to inject a little common sense. We could be having so much more space available to us. Probably less expensive to not be on that ground, prime real estate of a commercial building. Why can't we do it upstairs? Why can't we do something else? So sometimes you just have to push and ask the question and say, why can't we do this? I'm always the one who says, if you tell me this is the way it is because it's always been done that way, that is the wrong answer.
That's right.
Because I'm going to say, we're going to do it differently.
And Governor, why can't we do this? Not because it's the right thing to do, but because it makes economic sense. We have a national business coalition on childcare. Over 200 businesses. We did a report with BCG that showed that you get a 425% return when you offer childcare benefits. So this is to me, it's almost like economic misfeasance, right? If you actually don't solve the childcare crisis. So
absolutely. And like I said, I've been talking about it for over a decade, using my life's experiences, talking about businesses and how they can be more involved. I do believe that they are an important part of this.
Yeah.
Businesses can help us solve this.
They absolutely can. So we just listened to a panel, incredible research by McKinsey here about how paid leave can really unlock this enormous opportunity and this enormous economic opportunity. Because what the research really showed is the impact is going to be on women's labor market participation. When we don't solve the paid leave paradox, but we have so much more work to do, right? In making families aware that it exists, reducing the complexity. And you have been just an incredible champion of paid leave. I just cannot tell you the moms across New York State who just are so grateful to you,
Thank you.
And your leadership. And what have you learned, as you've talked to working families about paid leave and about paid leave policy and why it's so critical, what we can do?
Well, first of all, our law in the state of New York applied only to private sector businesses. It didn't apply to the government workforce. So when I first became governor, I instituted that there'd be 4 months paid leave for all people who work for the state capitol. I think I sparked a baby boom. Seriously, it's so incredible that everybody's having children, and I felt really good about that.
Yes.
I guess they're not sitting at their job, okay, but they'll come back. They'll come back. And we're finally starting to see a lot of men are doing it as well. And this has to happen. This has to happen for a variety of reasons. And as I mentioned, I'm a grandma now. And my daughter-in-law was able to get 4 months paid leave. She was home the first 4 months. My son picked up the next 4 months, totally on his own. And that shouldn't be such a big accomplishment. He did not make a big deal about it, but he was a little bit of an outlier.
Right.
And he was so proud of it. I mean, it just made him a different person. And the connection he has with that little girl is extraordinary. So I want people to know, just at a human level, if you're blessed to have, 2 parents and they can help out, it also saves you about 8 months of childcare.
That's right.
My daughter is expecting her first child this summer. And I said, how are you going to figure this out, sweetie? Can I help you in any way? And she says, I'm taking the first 4 months. Matt's taking the second 4 months, so we won't need anybody till probably next January. So that's something that's a gift to families. When you have if you work in a state where you get maybe just a few weeks off or it's unpaid, like you're right back to work. And it's a choice people make. You might want to go right back to work. I mean, for your own sanity or whatever, that's fine. But it's all about giving people options. But I think there's been a recognition that both partners
That's right.
need to step up.
And that was
not just one or the other.
That's right. And I think the most interesting part of this report is that men are the ticket to increasing access to paid leave. And one of the things I think we've all learned I certainly learned this in doing this report and doing this work on paid leave, is that, to me, like the durability of a policy depends on people taking advantage of it.
That's right.
And you see what's happening in Washington right now with DOGE, cut. And what's being cut are the things that they think that people aren't actually using.
Right.
And so they will cut paid leave, they will cut Medicare and Medicaid, if those policies actually don't have high durability because they don't have a high number of people using it. So it's up to us to make sure that we tell everybody that they're available and they get those $10,000, which is the difference between, poverty and actually, funding your child care.
I think they're going to cut everybody no matter what. That's just the Medicaid vote last night, the fact that they passed a budget that is going to leave 1.8 million high-need New Yorkers out in the cold if they don't fix that. So
I know you're not going to let that happen.
No, hell no. No, we're up for the fight. This is New York. We're hardwired to fight.
Well, you got an army of people behind you.
Good.
We're going to fight alongside with you. So what makes you even more of an exceptional champion is you're not just championing paid leave, but you're the first in the country to champion paid prenatal leave policy that gives workers the ability to take paid leave for any pregnancy-related medical appointment or procedure. It's huge. That went into effect in January. What was your goal, and how did that come to you?
Well, I'd also lived the experience. I was fortunate when I worked again for the senator in the Capitol in Washington. I was very pregnant. We work such late nights too, by the way. Sometimes you had to pull all-nighters, and so I'm as big as a house and had to stay overnight on the couch and sleep on the floor and all this because we're always working. But I was just acutely aware that there were other people who weren't able to take the time to go get their appointments. And even in the cities, I go to diners all the time, always talking to people, and I hear stories that have a profound impact on me. And hearing the stories of a woman, I did a roundtable with women, and she says, I can't go to my prenatal visits. Now here we are trying in the state to drive down the unconscionably high infant and maternal mortality rate, especially in Black and brown communities. It is shocking. And it is a place like New York that is so rich in bounty and resources, and that we have so many moms dying and babies dying. So the key to this is to make sure that they're getting all their well visits, they're getting all the checkups. And if you're a mom who says, I can't take that time off work because I'm working minimum wage and I get not a dime for that time, you might have to take 2-3 hours, and my children are going to suffer, my other children, because I don't have the paycheck, I'm going to forego those visits. And I said, that's exact opposite of what we need to have happen. I need these moms healthy. I need to have the early warning system when a doctor sees something that you need to be treated for early on, or when the baby needs something. And so it just came to me, and my staff is always looking for new ideas on how to push, how we can do better. So I was shocked to know we were the first in the nation.
Right.
Nobody else thought of this before. So we're the first in the nation starting January 1, and a lot of people are now telling me they're taking advantage of it. I just got a message from someone a couple days ago, and she said, I didn't know I could do this. I mean, I feel much better about my baby and our outcomes. Those are the stories that make you realize why you do what you do.
How did you convince businesses to get on board too? Because oftentimes what we find is, as activists and organizers, that a lot of times these policies are not getting implemented because business doesn't recognize it's not a nice thing to do, it is an economic necessity.
Right. And also, they would just look really bad opposing that. There's just certain things that, we're opposed to moms getting paid so they can have a healthy baby. And again, if they really want to be crass about it, if there's complications and this is your employee and now she's got to go for a longer recovery or if something happens, it could have an impact as well. So we did not get the resistance. Emily might know. Did we get a lot of pushback? Were you surprised that we got? Yeah.
No, I think that exactly as you said, Governor. I think they recognize that while this is new, that it's something that will help employees be happier at work and be safer. And it's an overall cost.
Yeah.
So no, we were pretty happy.
And I'll make them look really bad if they oppose it.
I want to talk about the New York's child tax credit. So in your state address, you promised to vastly increase in New York's child tax credit, doubling or tripling it in many cases. And we know, it's a move that expected to reduce child poverty by state by 8.2%. I just read an article today that in New York, 1 out of 4 is under the poverty line. 1 out of 4. So many of them are children. Why are you focused on the child tax credit? And what impact do you think it's going to have for families?
A profound impact. It really will, because for us to be able, let me step back. When you talk about childhood poverty, nationwide, of the top 5 cities across America, 3 are in New York. And it's not here. It is Rochester, Syracuse, and Buffalo.
Wow.
Of the top 10 zip codes with high poverty, 1 is in the Bronx, and 3 are in Rochester, 3 in Syracuse, 3 in Buffalo. So there's poverty outside the city, which is real, especially in our rural areas. Really high poverty in our rural areas. So what can drive change? And we talked about this. We were going through all of our state-to-state policies. We start in the summer to start coming up with new ideas for the January announcement of what I'm going to do in my state-of-the-state address. And we decided to focus on the theme of, your family is my fight. Your family is my fight. This is personal to me. Your family is personal to me. And how can we start having different outcomes, especially when it comes to poverty? What I found when I first became governor is that we had a child tax credit of $330, but it didn't cover children under the age of 4. Children under the age of 4, families got 0. I said, are you out of your mind? That's the most expensive time.
Yeah.
That's when, like I said, the diapers, the formula, the little food you had to buy. I said, what are we thinking? So we increased it for the first time. That was a big deal. It was like $330, it's not going to change your lives, right? So we started looking at data, and if we increased it to $1,000 for children under the age of 4 and $500 for older children, our data actually shows that we can decrease poverty rates in New York by 18%. Wow. 18% just with that change alone, because that's enough money for a family to just be able to get out from underwater. And it's not just that. I said, you think about the school lunch programs. The kids who get subsidized school lunches or breakfast, there's a lot of stigma with that. Actually, I heard this from a Republican senator on Long Island when I did a forum out there a few months ago. He came up to me, and this has shocked me but beyond anything I'd seen in a long time. He came up to me and says, what you're doing to say the state will pick up the cost of the school lunch program and the school breakfast. So there's no stigma. Nobody will ever know which child needs help, which child's parents can't afford this. He says, I was that child. And I never forgot being that one. I used to skip lunch all the time because I didn't want anybody to see that I didn't have enough money to get in the line everybody else did. So we are wiping that out. There'll be no more stigma, but also it comes out to $1,600 per child that you're not spending on lunches or having to buy the groceries to make the sandwiches or the breakfast. So you have 2 kids in school. That's $1,600 per child. You have $1,000 for a child under the age of 4, $500 for a child's school age. And you add all that up plus an inflation rebate, because we collected $3 billion more in sales tax revenues only because of inflation, because everything went up, we collected more in sales tax. I said, that's not our money. That belongs to the people of New York. Now everybody's got their ideas on how they want to spend it. I can't do recurring expenses because it won't be there next year.
Yep.
So a one-shot check back to families. I have been going around to the mall in Queens and in grocery stores and walking around all over saying, how would you feel if you had $500 back in your pocket? And people just look at me with their jaws dropping. I say, I can pay for your groceries. I can help you with your bills. And they just can't believe that there's someone in government who understands it's that basic. We talk about the last election. Everybody says no one heard the voices of the main population. Like they're overlooked, that it was all, talking about saving democracy, but who's saving me? And there was a lot of focus on those who felt they were not listened to. And I want to make sure they knew that I get it. If I can put, everything I added up now, including our middle class tax cut, we can put $5,000 back in a family's pocket if they've got a few little kids. $5,000 because of what I'm trying to do in my budget. And I need help to get it over the finish line. Everybody has differences of opinion. Let's spend it here, let's spend it. I'm focused on the families. And what I believe is going to make a big difference is getting this done, getting this tax credit in place, and start driving down those numbers that are embarrassing for a great state like New York.
That's right. Let me talk to me about consensus, because one of the things I think that's remarkable about your leadership is your ability to get consensus. We're doing the same thing at Moms First. We've really built this movement because none of these issues are partisan. Affordable childcare is not a partisan issue.
That's right.
Paid leave is not a partisan issue. If we believe in being a nation that is friendly to families, that wants people to thrive, wants people to have children, then we have to make it affordable and possible and aspirational. And right now, let's be honest, it's not. And I think both Democrats and Republicans often say the same thing in terms of what they want. So a lot of people's eyes are on New York State, as this is the place to make it happen. What have you learned about building consensus, especially from people who are not from your party?
Well, first of all, Albany has a certain reputation. And
really?
I knew I had to go in there and say, it does not have to be a blood sport. We do not have to be at war with the mayor of New York, for example. There's nothing preordained that says I have to fight with the legislature publicly every day of the week just because I can. And I inherited a culture that was very different, not accustomed to someone who's willing to sit behind the closed doors, work it out over long days. But I don't have to have it spill over to the press to see that we're in conflict right now, because I will get us to a place where we agree. I'll work it out. I'll take time. I'll give you what you need. I need to get this. And some people think that that's not a sign of strength because they're used to a certain model, certain model of what you have to be governor. And I set out to prove that that is not true. And if you look at the accomplishments we've achieved, the most significant housing package since the 1960s, according to the New York Times. We've done things that people didn't even touch before because they were just too hard. And the harder it is, the more I'm going to lean into it, because if not me, then who? So I have worked very hard. Now, people should not underestimate how hard I'm willing to fight, and I'll punch back hard. But I sat down with the Republican leaders yesterday morning, talked to them about what they would want to have happen. I talked to the Democratic leaders. So people know that I'll fight for our values, especially against Washington. Happy to take on that fight. But if I can get people to yes without a public display of conflict that they've gotten used to, but I think it just calms things down. I'm trying to calm the city down. I want to calm the state down. So people know that they don't have to be caught up in our drama.
That's right.
We're just competent, good people that are looking out for you. Just basic government service. And then you can get on with your lives and not worry about everything that's happening and swirling around. We shouldn't be creating more stress for people.
Yeah.
And I can do that by just being this, I think it comes when you're a mom too, raising kids. I'm used to kids fighting all the time. And
I had some fighting this morning in my house. That's right.
My turn to sit in the front seat. How come she's staring at me? I was like that was my piece of pizza. So I've gone through every fight there is. I mean, ultimately I raised teenagers, so you all look too young to have teenagers if you're a parent, but teenagers is this next level. But now those teenagers are incredible adults. They say the traits you don't like in a child are wonderful traits in an adult. And I've always said this as well. We're not here to raise kids. We're here to raise adults. And I want them to see me as a mom that can do anything. My son is probably one of the strongest feminists in the country because he saw what I've had to go through, 30 years of elective office, and I wanted him to be that kind of parent for his daughter. And my daughter's going to have a daughter, and I want this to continue on, that you govern with strength, but also it doesn't have to be combative.
That's right.
Unless you're pushed too far.
Yeah, you want to. That's right. I think that's a great lesson about being a sturdy leader. I want to shift gears as we kind of close up here. On the second panel, we'll be hearing from people talking about applying, emerging technology like AI to solving some of these problems. I'm so proud, at Moms First, with us building paid leave data AI and being one of the first kind of uses of AI for a public sector benefit.
Yes.
And we partnered with Sam Altman, a dear friend of mine, to really do this. And you've also been trailblazing on AI. Last year you established the Empire AI Consortium, $400 million, which aims to make New York a global leader in AI for good, with cutting edge technology, cutting edge research and discoveries to solve big problems. This is the core of what Girls Who Code was built on, and I think it's the core of your ethos in this. And so, what have you learned from this investment so far? Are there any applications that surprised you? And is there anything for so many of the young leaders that are in this room that want to solve real big problems and want to be thinking about how could AI actually help them do that? What do you have to say?
This is such an extraordinary time to have access to this incredible technology and innovation. I mean, Columbia is one of the partners. We put together a consortium a year ago. Totally came out of the blue, an idea that I heard at breakfast one day, and someone says, you got a 10% chance of making this happen, but let me describe to you what could happen if we invest money from the state level, bring together academic partners, the powerhouse academic institutions like Columbia, and allow all of them with private sector dollars to have access to the most powerful supercomputer dedicated AI in the entire country outside of private sector hands. We're the only ones who have this. My friends in government in California wish they had gone ahead with this because they now know we're on the map. And I wanted to be able to democratize AI and not have it just in the hands of the privileged few, and have it available to all of our researchers. And young people are just trying to think of how can I solve this problem? And what inspired me was learning there was a young woman at the University of Buffalo, a woman of color, a PhD candidate, and I said, what are you working on? And she says, I'm trying to solve through AI how we can get a more efficient, better foster care system because I came through foster care. And I thought, bingo, that's what I'm talking about. Using your life's experiences, making it available to everyone who otherwise would only read about it in the news and never know about it, be able to experience it. And we're making a real difference. I mean, we will find ways to predict weather in a more efficient way than us being slammed with climate change effects that are just wreaking havoc on our state. Or this child care crisis. Right. I mean, let's get people using ways to solve this. What are the answers? And it's so brilliant at this time that people long before all of us tried to solve these, but did not have these tools. And I'm, as governor, putting them in the hands of the people of the state and saying, go for it. Go figure it out and tell me the solutions.
Fantastic. Well, listen, we are so grateful to have you here today. You've inspired so many of us. Lead with your motherhood, I feel like, is such a takeaway. And this idea of being a sturdy leader. And so we are grateful as New Yorkers. I am grateful as a New Yorker to have that in my governor. So thank you so much.
Thank you very much. Thank you. Thank you. Thank you.
welcome to the stage Rachel Vogelstein.
Good afternoon. My name is Rachel Vogelstein. I serve as a professor at SEPA and as the director of IGP's Women's Initiative, together with my colleague Jen Klein. Our discussion today reflects the goal of the Women's Initiative here at IGP to share innovative research and policy solutions to advance women's full and equal participation here in the U.S. and around the world. And to that end, I am especially delighted to introduce our final panel of the day, entitled Innovation in Action, Making Government Work for Families. In this panel, we will explore how technology can be used to improve government benefits and services, including resources like paidleave.ai. And we are fortunate to be joined by a terrific group of leaders and innovators, including Craig Newmark, who started Craigslist 30 years ago Saturday, and is also a self-described nerd and the newest member of the U.S. Space Force as a certified space cadet. Welcome, Craig. We also have Deborah Singer, the Chief Marketing Officer of Moms First. Welcome, Deborah. And Loris Toribio, the Director of Economic and Fiscal Policy at Robinhood. It's great to have all of you. My terrific colleague, Camille Francois, an Associate Professor of Professional Practice here at SEPA, will moderate the conversation. Camille, over to you.
Thank you. Hi, everyone. Thank you so much, panelists, for joining us. I'm quite excited to have this conversation together. You all bring different perspectives on how we can leverage innovation in the context of government services. Craig, let's start with you. I think my colleague alluded to that, but reading your bio is a very interesting experience. Half of the titles are very confusing, starting with the fact that you've been a nerd in residence at Veterans Affairs. Maybe you're also going to tell us a little bit more about this whole space cadet thingy. Please do that, and I'll continue with the nerd in residence questions.
Well, starting with the Space Force thing, just days ago at the National Governors Association, the folks at Space Force like the fact that I'm a big supporter of military families, so they've inducted me, now realizing that I've had the title of Space Cadet for about 70 years. Nerd in residence at Veterans Affairs. I do have a sense of humor, but what I realized is that maybe I could help with tech innovation, maybe other matters. What I learned is that they didn't need any help from me for tech innovation. They needed help, I guess, more thoroughly embedding the notion that customer service is a high ideal. They needed to do better for their customers, vets, and to do that better, they needed air cover from the White House. I was able to preach the mission of customer service then, but given my political naivete, I was no good at the deeper needs.
Yeah.
Now, lots of things have changed.
Tell us just a little bit about this notion of customer service. The first time you told me about it, I thought it was really interesting because you've done customer service in your tech career, which is something that is a very natural thing for tech innovators to think that you design product and you need to make sure that people have the context and the hand-holding to fully use them. What did you learn bringing that into a government context, and how are you taking this forward in your philanthropic endeavors now?
I learned in a way that everyone wants to do a better job of customer service. It's a way of living the notion that you want to treat people like you want to be treated. People need a permission structure to do that. They need to believe that management believes in it. And generally speaking, if management did believe in it in the past, they don't anymore, which is why I'm now considering how you can do it with much less management investment.
And in your philanthropic career, one of the things that you've funded recently in the pursuit of that idea is, Deborah, I'm coming to you for this one, is paidleave.ai. Do you want to just give us a sense of how you both met around this project? And then, Deborah, I'll have a few questions for you on paidleave.ai, that amazing chatbot, right? AI-based chatbot that help parents navigate and access parental leave. How did that sort of partnership come to be?
So Craig has been a longtime supporter of Girls Who Code. And as we heard earlier, Moms First and PaidLeave.ai grew out of Girls Who Code, and really seeing the opportunity to ensure that we're set up to support moms as we're trying to focus on closing the gender gap in tech. We launched PaidLeave.ai a little over a year ago as a pilot first in New York with early support from OpenAI and Craig Newmark. And we're pretty blown away by the results. We had tens of thousands of people visited in the first month, and really felt like we were meeting this need that parents had to help them understand these relatively complex benefits and navigate a process that isn't always transparent. And so we expanded the tool nationally with support from Robin Hood Foundation and Capital One, and really see it as one of the first case studies of how you apply AI to government services and how you use and harness innovation to make government services more accessible to more people.
Yeah, we learned today through the McKinsey report that 3 out of 5 parents do not take their parental leaves, and I'd be curious to hear the 3 of you on like what do we think are some of the underlying factors here that can be addressed by technology and innovation, and that you're hoping to address with PaidLeave.ai.
So the kind of first big opportunity that we see is around awareness. Awareness is a barrier to so many government services. When it comes to paid leave, 2 in 3 parents who didn't use it didn't know about it. And so we have to start by really meeting parents where they are. And in 2025, that's on social media. And so in the last year, we've been running a series of tests of how do we meet eligible moms on Instagram, on TikTok, on Google search when they're looking for information about paid leave, and how do we make sure they know that these programs are available, and how do we help them navigate them? And we've found that these are incredibly successful programs. We've driven tens of thousands of visitors to PaidLeave.ai just in the last couple of months in New York and California. We saw a 20 times increase in Google searches nationally for paid leave, which really confirms that we're helping to drive awareness. And so we're excited to expand that playbook to more states. And also, importantly from the research, think about how do we include men in that playbook, since men are going to be really critical to unlocking paid leave utilization.
Craig, you wanted to add something?
Well, you were asking before about what we're doing with PaidLeave.ai and motivation. See, I've been a customer service rep for going on 40 years, and I see how bad it can be these days. My objective is that if we learn how to do customer service with some real commitment for PaidLeave.ai, then that applies to all government customer service, and then it applies to all customer service everywhere. It does mean real commitment on the part of management everywhere, getting good customer service reps to feed into the large language model and to use what they call a retrieval augmented generation as well. But if the commitment is really there, it actually means better customer service and possibly replacement for call centers, which are great exercises in frustration.
That's true. Something that's not, I think, immediately apparent when we discuss all of your work is we tend to sort of apply these tech-driven concepts. Sometimes we can even say Silicon Valley-driven concepts, right, to public policy, to social problems. But what I'm seeing in all of your careers is there is something very different in building technology for the public interest. And Loris, I'd love to hear you on that, because I know that with your work at Robin Hood, you've done a lot of work leveraging innovation for the public interest. You recently announced the AI for Poverty challenges with a lot of new solutions, but doing so isn't just sort of taking the out-of-the-box tech that's made in Silicon Valley and sprinkling it on social problems. It's an approach that ensures that the people who are affected by these technologies also have a voice and agency in how they're deployed. And I think you've pioneered a lot of great projects on this. Share with us, if you can, some of the lessons and some of your highlights on how we do this differently when we center the public interest.
Sure. So one of the guiding principles at Robinhood is that the people who are closest to the problems are closest to the solution. Proximity is really important. And that is something that is embodied through Blue Ridge Labs, which is Robinhood's venture studio for scaling innovation. And my favorite example of how we bring community voice and the voices of those who have lived experience with the problems that we're trying to solve. In Robinhood's case, low-income New Yorkers who are receiving benefits and are experiencing challenges of economic hardship. And they have a program called the Design Insight Group, and it's a community of over 5,000 low-income New Yorkers who provide direct input into startup founders' design for social impact problems. This program also provides the monetary compensation. So they're paid $30 an hour for their expertise, for their time. And this is something that was incorporated into the AI Poverty Challenge. The finalists were required to consult with DIG members to really test out how their design solutions really met the realities of people who are experiencing those challenges instead of having them being based on assumptions. The Design Insight Group, I think, is one of the gems that Robinhood has when it comes to innovation and ensuring that we're really solving problems that people are actually experiencing. And when it comes to public policy, we've also worked with them on things like including questions, input, concerns into things like a mayoral forum that we held a few years ago during the mayoral campaign, and also just like trying to understand what are the administrative barriers for accessing tax credits like the child tax credit, earned income tax credit, and how to be more involved in policy design.
Yeah, it sounds like there's a whole universe of government programs and benefits that could, no puns intended, benefit from more innovation. I'd be curious, Deb, how you think about scaling what PaidLeave.ai is currently doing. You talked about first scaling it regionally. It sounds like your first pilot was very successful. Talk to us a little bit about how, what else can this approach solve in the realm of issues that you're tackling?
Yeah, we think it could apply to a lot more benefits than just paid leave, but I think as we saw from the research today, there's a lot of opportunity in paid leave. So it's definitely where we're starting and where we're focused on now. But as soon as you get curious about benefit utilization, you start comparing it to other benefits, and you start to see the opportunity in childcare subsidies, in child tax credit, and all of the kind of family-friendly policies that we know make up the constellation of benefits that families need to make ends meet today. And what we've learned so far about AI is that the technology is relatively the easy part. We're building on top of large LLMs like, in our case, OpenAI's ChatGPT, which means that, for instance, the product's available in 80 languages, just out of the box. But what is hard is awareness and ensuring that you're reaching the right populations of folks that actually need these products. And so that's where we've really been focused on the opportunity, and think that there's room to grow and expand into other benefit categories.
Does that resonate with your experience too? Technology is actually the easy part?
Yeah, I mean, when it comes to innovation and like philanthropy's role in innovation, there's a lot of really great solutions out there, but the challenge is will the public sector adopt it? And that requires political will, it requires consensus building, it requires trust, and it requires partnership, not just with government, but also with the beneficiaries, like the nonprofit sector. So there's a lot of additional work beyond coming up with a solution. You also have to think about what does it look like in practice? What does implementation look like? And also, how does it get adopted through legislation or through the budgetary process? Is it a regulation? So it's going beyond just like innovating and making sure that it is something that actually is, implemented and useful.
Do you have top of mind examples of areas where you've seen this go well and areas where you've seen this not go particularly well?
Well, I'll share, we've talked a lot about the child tax credit today, but whether or not a solution or a policy or product works doesn't necessarily mean that it's going to be adopted. The child tax credit has an enormous amount of evidence that it is one of the strongest anti-poverty tools. And we saw it play out in real time with the American Rescue Plan. When they expanded the federal credit in New York State, it decreased poverty by 40%, across the nation by around 50%. And when it expired, poverty rates went right back up. Why did we let that expire? There seemed to be political will to include it in the stimulus package, but that momentum wasn't sustained. The Congress did not make it permanent, and right now it's really up to the states to do it. So it's not necessarily that it's not good policy. It's that you need to create the conditions to ensure that the policy gets enacted and implemented. And I do want to shout out Governor Hochul for introducing the child tax credit in her extensions of child tax credit in the executive budget. This is something that Robin Hood has been working on for a really, really long time, and have been working on building consensus and coalition building. And that's the other part of the innovation piece, where you have to work with the partners and ensure that you're investing in the advocacy beyond just the technology or interventions.
Yeah, Craig, that was also kind of your main highlight from being a nerd in residence, is that so much of that also depends on, I think you said, management and political will, right?
Yeah, customer service in any form, to do it well, requires some kind of management commitment, but much beyond lip service. I'm of the impression that if a manager is put into customer service, that's a way of terminating their career. And yet, whether it's government or a private enterprise, there needs to be a genuine commitment, I think. And I don't know how to motivate that, except by talking about it a lot, presumably fairly loudly. I did some of that at Veterans Affairs, roughly 2012. And the only thing that made persistent change, I was told after the fact, was that my business card says founder and customer service rep. And that message apparently resonated after I left.
You're talking about persistence, and Deborah, you highlighted that some of the challenges that many people are experiencing is navigating the benefits, is that lack of awareness, complicated red tape. It looks like maybe we're heading towards a season with diminished investment in some of these programs at the federal level. And I wonder what that means for the role of philanthropy and for the role of innovation. You've talked about agentic AI, the idea that, for instance, we could empower customers with their own agent who are going to go fight bureaucracies with maybe more persistence than we would have without that on their behalves. I'd love to hear the three of you on, if we are facing, for instance, diminished investment in some of these programs, what is going to be the role of philanthropy? What do you see as being the role of technology to ensure that people can better navigate those barriers at a time where maybe we will have, again, lesser commitment from management or political powers?
Intuitively, I'm excited about what agent technology can do for us. If, again, there's a commitment on the part of the providers of those agents to genuinely learn and get better at things, because that could really help out it's a little scary when you think that the same technology could be applied to breaking into our systems. And since, as a nerd, I read too much science fiction, I worry about what happens when agents start fighting each other for critical resources, becoming smarter and smarter, and may decide to launch Arnold Schwarzenegger back in time to kill us all or something.
Yeah, nobody wants that.
And I think I stole that joke from Bruce Sterling. Yeah. But the idea is that my intuition tells me that if people learn how to properly train agents, then there really is something there, but there are unexpected downsides aside from cybersecurity issues.
Lori's Deborah.
I'll speak a little bit about the role of philanthropy in investing in these types of, in investing in technology. And one way that, one role that philanthropy can play is in capacity building. One of the issues that we've noticed, especially when it comes to the utilization of things like AI and other emerging technology, is that the nonprofit sector and presumably also like the public sector, they're increasingly interested in utilizing AI to enhance their operations and efficiency and services, but they lack the technical expertise to do so, and also there's a cost burden associated to it. And one of the ways that Robinhood is solving for that problem is by creating a partnership that includes intermediaries, AI technologists, and nonprofits to ensure that the AI technologists are able to offer that technical assistance with like a tech for good approach, so that they are able to capably use AI. And we're also seeing that we need to really come up with solutions to upskill staff and advance the AI pipeline to be able to take advantage of the technology.
Sure, and build it in a way that, per Craig's very nightmarish sci-fi scenario, also addresses some privacy and cybersecurity concerns. I have to admit, at IGP, we run a program on technology. One of our sub-initiatives is about red teaming, which means we try to break AI chatbots at a set of systems, and we try to figure out what is it that we learn out of it. I did do a little bit of that on paidleave.ai today. It did resist a lot of my weird attempts. I, congratulate you for what seems to be a fairly secure system. How do you think about that, since you are, deploying technology for the public interest and innovation to help people access government systems? How do you think about the, trust and safety underpinnings of those systems that you develop?
Yeah. Well, first, I think we should do some red teaming after this.
I'll tell my students. We'll have a blast.
We would love you to send your students to us and see if they can break it, because I think that's how we make it better. And I'd say the ethos is one that we learned at Girls Who Code, which is it starts with who's building these programs and these products, because that's what's going to make, I think, if people understand the people that are building them, and that they come from their perspective and reflect their background, that's a great starting place for trust. And then I think you have to do relentless testing and focus groups and user interviewing. We partner very closely with community-based organizations that have existing relationships already with low to moderate income moms, or moms who are new to this country. And we do testing with them and ask them to use the product and then give us feedback. And one of the things we learned recently, we know this tool is available in 80 languages, but we for sure have not tested it in 80 languages. But we partnered with an organization called Upwardly Global that works with new immigrants and helps place them into highly skilled jobs. And suddenly we had a native Ukrainian testing it, a native Farsi speaker testing it, and giving us insights that we never would have had before. And I have to imagine that that is the basis for how you build trust with users. You help them see themselves reflected in the product, and that you show that you're listening to them.
Yeah, that's great. Craig, any insights on this one? I know It's close to your heart.
Yeah, I'm very concerned that sites which use large language models take proper care for those uses intended for kids. Since I'm not very smart about it, I've delegated that all to Common Sense Media, which is best known for rating movies and TV for those purposes. Aside from that, I'm thinking a lot about, how do you, if a company is committed to trust and safety, how do you avoid poisoning your large language models with sources that might be dubious? That's a really tough one because the databases that are fairly safe, some of them are under attack by foreign military who are concerned with their ability to effectively run influence operations.
Are you thinking Wikimedia, for instance?
I may have spent a lot of time with Wikipedia yesterday on that.
That leaves us with quite a lot to build. Quite a lot to secure under our feet as we continue building for the public interest. And I know that we're standing between cocktail and the end of this session, so I'll ask you all for a word of closing on these questions of how do you, sustainably leverage innovation to tackle some of these issues, something you want to share, a lesson learned or a hope for the future. Loris, let's start with you.
I will shout out something that is not directly related to public benefits or really the public sector, but through education. And we have this fund called the Learning and Tech Fund that is focused on ensuring that students are equipped with the computational thinking skills to be able to navigate a digital world and have which is like a precursor to things like coding, for example. And really, the pandemic really showed us that we absolutely have like a tech skills gap that we should be addressing from like elementary school and making sure that these foundational skills are integrated into all of our curricula and in the way that we teach, so that later on, when emergent technology like AI, et cetera, sorry guys, I'm not like a technology person, I'm a policy person. Although Robinhood does fund innovation, all of the stuff that we were talking about earlier, that's my area of expertise. So I'm trying to fit this in. But yeah, I mean, I think we, with the Learning and Tech Fund.
I will deny you on that, because the way you think about policy, the way you think about putting users first and centering those who are going to be affected by those technologies is a design thinking, right? Like that, I think everything that you're bringing with your policy mind towards how we deploy this technology is very much a technology thinking.
I appreciate that. Thank you. But yeah, it's important to make sure that we're teaching the younger generation to be able to have those like digital thinking skills later on.
Deborah, besides calling for my students to go break your website, which we will do, we'll take you up on that.
Amazing.
Anything you want to leave us with on
good cocktail chatter? I would love for the students in this room to kind of turn their gaze to policy adoption. I think policy adoption is not sexy. The sexy thing is to focus on passing new policy. But what we've seen is policy adoption is the linchpin. It's what's going to make the difference between putting money in working families' pockets and also expanding and building a constituency for policies that we have passed that can be taken away if there aren't people that are fighting for them. And so I would love for the folks in this room who are thinking about their thesis or next research project to get curious about policy adoption rates. How do you measure them? How do you improve them?
Craig, as a space cadet.
Yeah, technology is easy in comparison. Policy is hard. Policy means convincing decision makers to, treat people like they want to be treated. That's going to require a persistent annoyance or irritation. That's something I can do. but it also requires constant persuasion, exercising considerable social skills. And for that reason, I've delegated that to other people that I funded, because what you may think is me exhibiting some social skills is just a limited amount of fakery. And I can fake it for maybe 90 minutes at a time, but if I'm really smart, I'll stop talking.
Then can we get Craig.ai for the rest? No, I'm kidding.
We have proposed Craig GPT.
Yeah. Thank you to the three of you for the amazing work that you're doing, giving us some hope and optimism in how we can meaningfully leverage innovation in the realm of benefits and government programs. Thank you.
Thank you.
Thank you. Thanks, everyone. Thank you to all of our speakers. You've really inspired us about the future of paid leave. I want to thank my Moms First team, Deborah Singer, Nina, the whole crew who really made this happen. Thank you, Craig, for your wonderful jokes, your sci-fi reference. Thank you, McKinsey and Company, for your brilliance and your research. Thank you, SEPA, for hosting us today and giving us a platform to invite the governor to have this critical conversation, and to all the students and faculty here for your time and attention. And so now, wine and cheese. Thank you.